Welcome back. The coronavirus pandemic is soaring at an alarming rate across the United States. Hospitalizations on the rise in state after state. But listen to this. A sobering report shows Latinos are 3 times as likely to test positive for COVID-19, 5 times as likely to be hospitalized, and twice as likely to die from it. One of America's top medical experts delivering an alarming warning to Congress, calling this pandemic the historic decimation of Latinos in this country. ABC's Victor Akendo has more.
The sounds of the mariachi are unmistakable. From the gold trumpets to the strumming guitarrón. But today, the music that so often marks life's joyful moments at weddings and quinceañeras is playing at this funeral mass.
We are here to say farewell to the loved ones who lost the battles against COVID-19.
We asked and decided to do it now in October because it's from the Dia de los Muertos.
The people here, a tight-knit community of Mexican immigrants from Chinantla, Puebla, honoring loved ones that never received a proper goodbye.
When they hear our notes and our songs, our lyrics, we want them to feel that they're in Mexico, that they're there with their families, connect them in some kind of way.
Eric Pérez Cantor, Justo Calixto Andón.
Their photos, a reminder of lives cut short from a disease that has ravaged communities like this one. According to the CDC, Latinos are dying at a disproportionately high rate from COVID-19. A recent analysis of more than 114,000 COVID-related deaths between May and August found 24% were Hispanic or Latino, despite being only 18% of the U.S. population.
Paula Felipe Ramos.
Lucero Martinez Felipe has waited 6 months for this day. Her mother, Paula, died on April 16th, just 3 weeks after getting sick with COVID-19.
I miss her, and I needed to find certain peace in myself, and I think today I was able to actually feel peace for the first time since the day of her passing.
At the time, cases of the coronavirus growing exponentially in New York City, quickly becoming the epicenter of the global pandemic.
Health officials fearing another deadly wave on the way.
Here at NYU, COVID testing tents have been set up for students.
Illinois breaking its own record of new cases.
Fast forward to a week before the 2020 presidential election, a profound transformation to our way of life. Hospitals once again stretched to the limits to care for a new wave of COVID patients in places like Utah and Wisconsin. The U.S. surpassing a staggering 8 million cases. One of them, President Donald Trump.
Don't let it dominate you. Don't be afraid of it.
That message, after the president left Walter Reed Medical Center, was a gut punch for Lucero.
He's privileged. Did every single person that lost their lives receive the same treatment that he did? They didn't. He had all these resources that none of us did.
At least 225,000 lives have been lost, the numbers growing every day. The COVID-19 outbreak becoming a top issue for Latino voters.
I think I always knew who I would not vote for, and it definitely won't be for the one that just stood there and watched it happen and didn't do much to help us.
Dr. Peter Hotez, one of the world's leading experts on vaccines, is growing more alarmed by the data.
What we're seeing really is historic decimation among the Hispanic community by this virus.
From the Rio Grande Valley to the big cities, a troubling pattern emerging throughout the nation.
Given the fact that it's hitting Hispanics in their 40s, 50s, and 60s, what that really means is it's robbing families for this whole generation of their mothers and fathers and brothers and sisters.
For brothers Isaiah and Nathan Garcia, it is their painful reality, losing both parents to the virus in Houston this summer, just 2 weeks apart.
I didn't get to say goodbye to my mom or my dad now, and that's what hurts me the most right now.
It's been really devastating, and not only in terms of the number of people who are dying, but also affecting a much younger age group.
Elizabeth Romero saw COVID-19 sweep through her Long Beach community.
I was like, we're strong, we're young, we're healthy. We could get through this. I never knew it was gonna take my husband away.
Elizabeth was on the phone with her husband, Jose, who was in the hospital bed when he suddenly went into cardiac arrest.
And the machine's just going off like crazy. 45 minutes I was on the phone. They tried 45 minutes to bring him back. And I'm like, no, not my husband, he cannot be gone.
Her life and the lives of so many others shattered by COVID-19.
Why are Latino communities getting hit so hard by this pandemic?
We are essential workers, much more likely to be essential workers. We have to be out there. In the pandemic, some of them had to take public transportation. There was no choice. Also, many of us live in more crowded housing, places of higher social density. All those things have been a major issue why Latinos are at higher risk.
Dr. Olvin Carrasquillo, a Puerto Rican native and chief of internal medicine at the University of Miami Health System, is determined to help his community. He's leading one of the clinical trials for the Johnson & Johnson COVID-19 vaccine and is calling for more diverse participants.
We need more minorities, both Latino, African American, to participate in these studies. We need to make sure these vaccines work on our people.
He says health disparities among Latinos are compounded by one's immigration status and lack of health care coverage.
They would say, no quería venir, pero no me quiero morir, which means I didn't want to come, but I didn't want to die. And you see these young persons with immigration issues that really didn't want to come. They worked down in the fields in Homestead. They came in really sick with extremely low oxygenation status. And you could tell, you saw the fear in their eyes.
Homestead, Florida, just 40 miles south of Miami's famous beaches and nightlife, where these farm workers toil in extreme heat, harvesting food.
This is the invisible workforce that kind of uplifts the country, and yet the country is not uplifting them. And we have to kind of start changing our mentality and thinking, you know, the farm workers that feed us, maybe they need to come first. They have to be the first in line to get the resources and the help that they need.
The fear of bringing the virus home, all too common for Latino essential workers, many of whom live in multi-generational households.
La enfermedad no sabíamos cuánto nos iba a desarrollar, si íbamos a acabar en un hospital, si íbamos a fallecer, qué iba a ser de nuestros hijos.
And with the temperatures cooling, more families are expected to hunker down together indoors. The nation's top infectious disease specialist, Dr. Anthony Fauci, warning that the number of deaths could grow to 400,000 if precautions aren't taken this fall and winter.
One of the biggest holidays for Latinos, Christmas Eve, Noche Buena. You're saying it should look different this year.
Look, my brother bought a house. We're all planning this big lechon and all this stuff, and now we don't know. How do you have Noche Buena without a lot of people? If you ask me right now, that's what I would recommend. Small event, especially if I had older people in my family, which we all do. You know, there's no way I would want my mom to be in a social setting with 30 people. That's just not what I would want, as hard as it is for us.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.